Rachel Brown, and I am going to be speaking to you today for the Employer Health Services monthly newsletter video. We're going to be talking about respiratory season. A lot of you have already reached out with questions regarding what to do about COVID. Are we still doing the same kinds of things that we were doing when we were in crisis mode a couple of years ago, or have recommendations changed? So let's talk about that. I'm going to share my screen, pull up some slides for everyone to look at. And we're going to be talking about vaccines as well, because there are some new ones out there, not just COVID, and we want to know what's going to be best for all of us. All right, so respiratory season is back. Want to let you know that when someone comes to you and they tell you that they have congestion, fever, cough, we don't know what that is yet, right? Because there's a lot of diseases out there during respiratory season. This could be the common cold. It could be an extension of allergies. After all, we do live in South Carolina. But flu will also be coming back. That'll be around the corner. It usually hits about October-ish. We did talk, of course, about COVID. We're always concerned about that. And then let's not forget about RSV. And what we found last season was that RSV rates were higher in adults than they had been previously. So that is something that we are going to see more and more in our employees and in our workforce, and not just in children. So let's pause here for just a second and kind of talk about the status. You've probably been hearing in the news that the rate of COVID cases is climbing. We probably don't know the actual rate because there are probably a lot of infections out there that aren't reported. They're either considered allergies or a cold, or someone doesn't get tested and doesn't know that they have COVID. We haven't seen flu and RSV spike yet, but we have seen a few common colds, summer common colds. So there are viruses out there already. This chart takes you through a few of the symptoms, prevalence, especially in children, whether there's a vaccine or not. There is a little bit of an update here. There now is an RSV vaccine, so this chart is a little bit out of date, even though it was created just a few months ago. But the bottom line is, as a clinician, when someone reports to me their symptoms, there's so much overlap. It's very, very difficult to tell what may be going on. I can tell you that in general, people feel worse with flu and COVID. People have much more secretions and respiratory type symptoms with RSV, and folks with the common cold tend to not have fever. But really, all bets are off when we're evaluating folks. So getting tested for these things is really the best answer. Now let's go to the next slide. Let's talk about how we can prevent them. Then we're going to talk about what we do when someone has them. So hand washing is still the number one defense against all of these things: COVID, RSV, flu, all of it, common colds. The only thing this isn't going to help with really is allergies. So hand washing, hand washing, hand washing. Using hand sanitizer is also effective. Vaccines are going to be the next most effective way to manage these diseases. And we're going to talk about each one of the vaccines in just a moment in a little more detail. Masking. Now you're going to see more people are wearing masks. Some people are wearing masks to feel more comfortable being out in public. Others may be wearing masks because maybe they're getting over something like COVID. Some people are choosing to wear masks if they're getting over RSV or the flu or even a cold because they don't want to give it to other people. So when you're working with your workforce, right now, there is not any kind of mask mandate, and quite honestly, there likely will not be a mask mandate put into place, but you can decide whether you think masking is important for your scenario. I would say, of course, allowing people and encouraging people who want to wear masks to wear them, and make sure that they're not getting mask shamed, for instance. Really avoiding sharing things. So if you're going to have that potluck over the holidays, probably don't want to have a buffet style approach for your get-togethers. We're going to talk a little bit about how nutrition and hydration can help. And you may be thinking, how is this relevant to me as an employer? If you can encourage your workforce to eat healthy, on the job and to stay hydrated on the job, and encourage your leaders, your team leaders, to make sure that that's happening for your workforce. You're going to have a much healthier workforce. Also encouraging sleep. And obviously we cannot go home and tuck everyone on our workforce in, but encouraging them to get rest, being aware if you find that folks seem to be more tired, or there are folks who are working more and more shifts, maybe having them go home and get some rest is an important part of keeping them healthy and preventing infection. One of the things that's most important to remember, and people get confused about this all the time, is that viruses that cause the common cold, RSV, COVID, the flu, cannot be treated with antibiotics. So many people think if I can just get a Z-Pak, I'll be fine. And that's not how we treat viruses. There are medications that can treat the flu virus, that can help with COVID infections, and can even help with RSV. They have to be started within the first 48, 72 hours of the onset of symptoms. And so folks who want to receive medicine, say for the flu, need to be seen by a physician, or a provider, tested for the flu or evaluated for the flu, and started on those medications as soon as possible. So we're going to talk a little bit about how you can help folks in that regard as well in your workforce. All right, so let's talk just a second about that nutrition piece. I just wanted to throw this in there so that you, and if you share this with your employees, have an idea of some of the best ways to boost your nutrition that specifically help with prevention of infection. Clearly, having great nutrition is going to make us healthy overall, but these are ones that can really help us as respiratory season hits. And so anything with vitamin C, you can see there citrus fruits and many vegetables are important. Live culture yogurt, which helps our gut health, means that we have a healthier immune system. Pumpkin seeds, we're in that season, right? So because they have a lot of zinc, they can help to ward off colds. Believe it or not, chicken soup, even though we always think of that as kind of an old wives' tale, has been shown specifically to help with the common cold. And that is chicken soup, not any other kind of soup. And then honey, as long as you're older, can help with cough. So there are ways that we can naturally deal with prevention, as well as manage symptoms of some of these respiratory diseases that keep us out of the drugstore. Let's talk about, for you specifically, how you can use these concepts of prevention and scale them out for your workforce. So the first thing is to encourage sick folks to stay home. And we know that this is a double-edged sword. We understand that you have to be careful about, losing too many people on your workforce. But ultimately, having folks who feel sick in the workforce, in the office, on the line, they're going to spread what they have. So the first line of defense is just to keep it out of the public area. Recommendations for folks who test positive for COVID is they still need to isolate for 5 days, okay, from the start of their symptoms. So the start of their symptoms is day 0, and then for 5 days after that, they need to isolate. So those folks do not need to be at work at all for those 5 days. As long as they're improving, they can come back after that, but they need to continue to wear a mask. For folks who come to you and say they've been exposed to someone with COVID, we don't have any requirements any longer that we keep those folks out for a certain amount of time. You can encourage them to wear a mask. I certainly would, and I certainly would keep them away from folks who are at higher risk. So folks with multiple chronic diseases, the elderly, that sort of thing, because if they are harboring that COVID, we don't want folks who are at high risk for complications from COVID to get it. There are some recommendations to test on day 3 and 5 if you've been exposed, if you don't have symptoms. So that can be encouraged as well. And of course, if someone who has been exposed develops symptoms, you want them to go home and test and stay home if they're positive for COVID. Now, I want to pause here for just a second because we talk about COVID, but really, we don't want to spread RSV, flu, or the common cold either. The difference here is that the period of time that someone is contagious when they have these other infections is shorter. So while someone may go to a provider and test negative for COVID, but maybe test positive for flu, we don't want that person in the office either, even if they're feeling like they want to work. So one of the things we recommend for flu, RSV, is at least a 48-hour period to recover. And in general, it's about 24 hours after their fever has resolved that you want folks to come back into work. So still keeping them out of work, but it doesn't have to be that full 5-day length of time, assuming someone is feeling better from those, either the common cold, RSV, or flu. The other way you can help with prevention and with identifying folks early to get them out of the workforce so that they don't spread these diseases is to ensure that they've got easy access to medical care. So whether that's an on-site clinic, which we can certainly help with, e-medicine, access to urgent care, permission to leave to see their PCP if they're having symptoms, whatever it means to give them that easy access to get tested, evaluated, potentially treated, like I said, early on in that disease, and been given the advice to stay home until they're feeling better. That's going to help keep your entire workforce healthy. So thinking about how you want to change those policies or adapt those policies given the last time we went through a COVID season is important to do now. So let's talk a little bit about these vaccines that I've been mentioning. We do now have vaccines for all three of these respiratory diseases. RSV is very new. The COVID vaccine is being manufactured to address the strains that we're seeing most commonly right now. So similar to flu, we're looking at what version is infecting folks in the current season and modifying the vaccine so that it really can attack those particular variants that are most common right now. Now, we know that there are folks who are worried and have concerns and questions about immunization. So I want to address some of those now. And a lot of this was addressed way back when COVID started, but I think it's important to think about again, because now we're really looking at respiratory season and vaccines as kind of a package deal, right? We're really not just focused on COVID. We're focused on all of the respiratory diseases that we can try to prevent, and importantly, prevent outbreaks so that your workforce productivity is maintained. So some of the benefits, let's talk about those first. We save on average about 3 million lives a year because folks have gotten vaccinated. The other thing about vaccines that's important to understand is you've probably all heard, for instance, with the flu vaccine, you can still catch the flu if you're exposed to it. Because the vaccine's not perfect, right? But what it will do is if you get the flu and you've been vaccinated, your symptoms will be much, much less severe. And if you happen to be someone who's at high risk, your consequences of that infection will be much, much, much less. And that is also the case with COVID and RSV. The other thing is it lowers our odds of passing on any of these respiratory diseases. And I've talked in previous videos about how being vaccinated keeps us from spreading the disease. So we may even be what's called, we might be exposed to it. It might be in our nasal passages, but we don't spread it in the same way when we're vaccinated as compared to someone who's not vaccinated. And so what you end up doing then is decreasing that likelihood of outbreaks among communities and populations. We also lower the cost that we spend. You lower your cost of taking care of folks who are sick. We lower our costs in healthcare of having to take care of folks who are sick because they've been vaccinated and are either completely protected from the infection or have very mild versions of the infection. And then, of course, you've got some vaccines out there that actually reduce the rate of cancer. And it doesn't get any better than that, right? So I'm thinking right now of the HPV vaccine. So there are a ton of benefits from being vaccinated that make a lot of sense. Let's talk about how they work. And this is a very, very simple diagram to explain how vaccines actually protect us from respiratory diseases. So what we have here is the vaccine, and in the vaccine is some component that's going to trigger our immune system. There is never a live full version of a virus in a vaccine. We never are giving folks the actual virus that causes the disease. We may be giving them a portion of it. So, for instance, a piece of a protein that's part of that virus might be in that vaccine. Or we might be giving in the vaccine a piece of the RNA, which is the blueprint for building a piece of the virus, like a protein from the virus. Okay, so we don't even give the entire blueprint to build the entire virus. We're just giving a blueprint to build a portion of the virus. So in either sense, we're seeing what's recognizable as that virus, but not the virus itself. So when our immune systems see this foreign piece in our systems, it goes to work and it builds antibodies that recognize that foreign piece and say, this is not meant to be here. They send all the immune cells in to destroy that protein, but our body learns that that's what it needs to do when it sees it again. Okay, so that's how immunity works. We're exposed to a piece of the virus. We either build it from the RNA or we actually see it because it's part of the vaccine. We build antibodies to recognize that in the future, and then we send those cells in to destroy that virus. So now what happens when we're exposed to the real virus, okay, not just a piece of it, is our immune system says, oh, we've seen this before. We know this is not supposed to be here. The antibodies trigger that response to kill all of the virus and get it out of our system. Okay, so that's how vaccines work. Want to be clear that you're not being given the actual virus itself. So let's talk about these myths that some people hear about vaccines. Of course, many people are concerned that vaccines are not safe. And despite how quickly it seemed that the COVID vaccine was developed, back in 2020 and 2021, the FDA does have an incredibly rigorous process which looks at the safety profiles of these vaccines. I also hear, well, vaccines don't work. And that harkens back to that idea that, I got my flu shot and yet I still got the flu. And that's because we have to remember that there are literally hundreds, if not thousands, of variants of these respiratory diseases. And so that piece of the vaccine may be somewhat recognizable if a different variant comes along, but not in exactly the same virus that our body had been trained to recognize. And so you get some protection, but maybe not fully. But what you do get is that decrease in symptoms, way less severe symptoms, and way less risk of consequences from getting the virus. We talked about vaccines not giving you the disease that you're trying to present. I'll have folks tell me, well, I got the COVID vaccine and I felt really awful afterwards, or I got the flu vaccine and I felt like I had the flu afterwards. That actually is your body's response. So remember, I told you your immune response is responding to what it sees in that vaccine and sending all the cells in to kill that virus. That is what causes fever. That immune response causes fever. It causes malaise. So it's not the disease itself. It's our own body's immune system fighting or building that immune response that can cause us to feel kind of crummy. Some people do, some people don't. It goes away in a couple of days, but that is not because we actually caught COVID or caught the flu. Want to be clear that vaccines never, ever alter your DNA. So even when we're using an RNA vaccine, in other words, we are injecting a small blueprint for a piece of a virus, that never enters any of our DNA systems or changes any of our cells' DNA. So that will not happen with these mRNA viruses. Some people think, well, I don't have to get vaccinated if everybody else does. The problem with that is you absolutely still can get this respiratory disease, and you have to be willing to face that consequence, certainly any of the risks that come with getting the infection. But also, if too many people feel that way, we don't reach that herd immunity. So civically, it does not make sense to say, well, everyone else will get it. I don't need to, because we need everyone to contribute to that herd immunity. And then finally, finally, I have young folks who'll tell me, well, I'm healthy, I'll be fine, and nothing bad will happen to me. And luckily, most of the time that is true, right? So a 22-year-old who gets the flu experiences a different kind of illness than, say, a 72-year-old who gets the flu. However, we learned with COVID that all bets are off in that regard. So even our young people can have quite severe infections from COVID in some cases. And we're not 100% sure why that is sometimes. We know that folks who have asthma, chronic disease, who may be overweight or have obesity, tend to have more severe consequences. But in some cases, when that hasn't been the picture for a particular patient, we're not sure why some folks get more severe disease than others. So regardless of your age, it's important to get vaccinated. So let's talk about what vaccines are out there right now. So as usual, we have our yearly flu vaccine. That changes every year based on the most common strains of the flu that we see circling the globe. This is recommended every year for all ages over the age of 6 months. So basically everybody except tiny ones get the flu vaccine. It's recommended that you get the flu vaccine. COVID, there hasn't been an official yearly recommendation yet, but everyone sees it coming, that it will become a seasonal respiratory immunization. I should say that today is September 6th. So if you're watching this a month from now, who knows what the recommendation will be. But we are expecting to see a similar recommendation as to the flu, where folks will get this COVID vaccine, which will again be manufactured based on the most common strains that we see, the most common variants we're seeing that season. And again, this is yearly for all ages over the age of 6 months. Now, if you've never gotten the COVID vaccine before, you will have to go through that primary series again. That's 2 shots of the mRNA vaccine. And then that yearly shot will be considered, quote, your booster, although we won't be calling it that. It'll just be your seasonal COVID immunization. So the RSV vaccine is the newest one that we've got out there. This is recommended again yearly, so it'll be a seasonal vaccine for those under the age of 8 months old. So this is for littles, especially those who are at risk, and over the age of 65. So this is not for all comers like flu and COVID. This is really recommended for folks who can have very severe consequences from RSV. Who knows what the future will look like for kids, a little bit older kids, and for adults, because we are seeing that prevalence of RSV go up in adults. But right now, the vaccine is recommended for our most susceptible. There's also a pneumonia vaccine. Don't forget about this one. It is not yearly. It has several recommendations based on which pneumonia vaccine you're getting, pneumococcal vaccine you're getting. But in general, this is for our older folks, or depending on the risk, if someone has severe lung disease. So if you're over the age of 65, make sure you're up to date on your pneumococcal vaccine. And I just have to throw in there, because my goodness, it is terrible to get shingles. It's not a respiratory disease, but I do want to throw in that this is another adult vaccine that you want to get once you hit the age of 50. It doesn't feel great. I've had it myself. It did kind of lay me out for a couple of days. My immune response was strong enough that I did feel pretty crummy for a couple of days, but absolutely worth it. If you've ever known anyone or had shingles yourself, it's absolutely horrible. By the way, if you have had shingles, it's still worth it to get the vaccine. It can decrease your outbreaks and help with symptoms for sure. You can refer back to this recording if you need to look at the recommendations from the pneumococcal vaccine. As I mentioned, they're a little bit different depending on which one you get, the PCV13 versus the PPSV23, or just ask your doctor or me which one you should get. I've also included a couple of resources here if you have employees or you yourself are curious about these recommendations around adult vaccinations, or want to see the recommendations for pediatric vaccinations. You can click on those links. They are live. The most important resource for you, of course, is us. So please reach out to us at any time. If you go to our Employer Health Services page and scroll down, you'll see this phone number here. We also have our website listed there. You can click on that. That is also live. Feel free to reach out to me at any time to have your questions answered. We know that there will be a lot of questions around what do we do now that we're back into respiratory season? Do we continue to keep folks out of work for 5 days with COVID? Absolutely, yes. Should we keep folks out of work who have RSV and flu? Absolutely, yes, until they're improving and they don't have any fever. But a lot of those cases end up being gray, as we've learned over the last couple of years. And so any questions you have, please reach out to us. If you're interested in wellness screenings, if you're interested in on-site clinics, direct primary care relationships to increase that access to primary care and to evaluation for respiratory diseases, we'd be happy to talk to you about that. In the meantime, we are here to help you so you can help your workforce, and I will see you in a couple of months.